Gems, welcome back to my channel. It's Jade here, and today I'll be introducing and interviewing my preceptor, pediatrician, Dr. Marcella Frausto.
Hi everyone.
So the first question that I wanted to start with is from my 10-year-old cousin who's decided she wants to be a pediatrician when she grows up.
Okay.
Her question is, what inspired you to be a pediatrician?
Well, I went to medical school, being the first person in my family to go to medical school, with the intention of being a surgeon actually. I had no idea I wanted to do pediatrics. When I got into my third year of medical school and started working with kids and doing my pediatric rotation, I seemed to really enjoy it. And I still kept it in the back of my mind, wasn't thinking I was going to do it. But once I had done surgery and I realized that wasn't for me, looking back, I said, where did I have the most fun? What patients did I enjoy working with? What kind of challenges in terms of my patient care did I enjoy? And it was in the kids. Working with kids gives me the opportunity to work with families. And not that you don't work with families in other specialties, but I got to work directly with the child and with extension the parents. Now granted, the kid is my main focus.
Right.
Working with kids, I took care of their health, but physically, developmentally, emotionally, psychologically, there's so much goes into pediatrics that I enjoyed. And that's how I completely changed my mind about where my specialty was going to be. I have my own practice and I still enjoy working with families. Yes, kids can come with their own challenges that adults don't have in terms of development, but that's what makes pediatrics a lot of fun to practice, and that's why I continue to do it.
What do you find the most challenging about pediatrics?
Speaking of families, then that becomes the challenging portion, because most of the time the kids, they're dependent on the parents to bring them. They have their symptoms, they come in, and for the most part, we can take care of their problems. Straightforward, they've got an earache, you've got an ear infection, you've got a sore throat, you've got a cold, we can take care of those things. But sometimes the challenge can be when parents are not as engaged with their children. They're maybe not meeting their emotional needs or the psychological needs of their child.
Right.
And having to address that aspect. Or you have families that are separated. There's turmoil within the families that plays an impact on the child, not just their emotional, but physical health can be impacted. So we have to look at the big picture. So sometimes it's not as straightforward as a kid coming in with an earache or a stomach ache. That could be a sign there's something else that's going on. A child coming in, my stomach is always hurting, but they're missing school. Well, are they having problems in school, problem at home?
Right.
That can sometimes be the challenge there. And it's a challenge that is worth taking, but it can be there.
Okay. So I think this also goes along with that challenge. How do you deal with the idea of having patients that can't necessarily tell you what's wrong with them? And do you believe this factor may make your job as a pediatrician more stressful versus any other specialty?
Well, yes, in general, because some of my patients are not talking.
Right.
So it does make it difficult. So you are relying on the parent to give you information, but also it requires me to be more astute in terms of my examination of the patient. I have to look for other little signs and symptoms that maybe the parents are not aware of, and to allow me to make the diagnosis that I need to make, because sometimes they're not going to give you a full picture. They may not even recognize it as a symptom. I have to be able to put those pieces together. And this does come into play with taking care of adults, but yes, adults are able to verbalize a bit more what their symptoms are, how they're feeling, when things are not working for the medications. So that does have an increased challenge of having a nonverbal patient, and even kids that have maybe special needs, they're not able to verbalize their concerns or their aches and pains. So we have to use a lot of other cues, knowing about child development, to be able to make the right diagnosis.
How do you deal with stubborn parents?
We were talking about this earlier today, weren't we? What I do is I inform the families and say, you know what, I'm here to take care of your child. I need your help.
Right.
Okay? And you have a really good reason to follow this treatment plan. This child is a really good reason. I've had parents who don't want to quit smoking. Well, it's a very difficult habit to break, but hey, mom, dad, your child is an excellent reason to quit smoking, and this is what we're going to modify that behavior. But sometimes it doesn't work. Sometimes parents just are set and they want a certain treatment to be done, they want a certain medication to be prescribed, and all I can do is educate. I can provide them with information of why it may not be the appropriate choice, and I have to sometimes let it go and say, well, I'm not going to put your child in harm's way. I'm not going to poke them. I'm not going to give them medication that not be beneficial for them. And if they're insisting, I may not be the doctor for them. I can't help them in that way. And it's unfortunate, but sometimes that happens. If the child's endangered in an unsafe environment where I think that the parent is going to hurt the child or that the child's not being treated in the proper way, well, then I have to get authorities involved. But that's our last resort. We really don't want to have to get to that point. But sometimes we do have those parents that have their own agenda when they come in. And I just try and educate. And that's basically what it comes down to, is educating the families about maybe this is not the best route. Let's try. And if I can convince them to go this other direction, so we can do the proper treatment. And we also say that your kid is depending on you. They can't take care of themselves. You need to kind of be their advocate, and most of the time it can be successful.
So you mentioned earlier that you actually thought you were going to be a surgeon. So someone asked me, if they go into pediatrics, could they at some point decide to become a pediatric surgeon, or would they need to begin as like a surgical resident or intern and then go that route?
My understanding, and now I've worked with pediatric surgeons, and that maybe would have an area that maybe I would have considered if I would have known about it maybe a little earlier on.
Right,
But
yeah.
Pediatric residency is 3 years.
Okay.
So if you want to do general pediatrics, 3 years of pediatrics. If you want to do surgical, the general surgical residency is 4 years long.
Okay.
Then if you want to do additional pediatric training, that's additional years.
Right.
So if surgery is the main goal, more than likely going through the surgical route and then doing a fellowship in surgery would be the route to go. Yes. Your residency is long anyways. So
Yeah, I know.
you know.
But what you don't want to do is think you're going into one thing, have your heart set on that, to find out that you're really interested in something else, and now you have to backtrack. So
And that's
better do your research first.
Exactly. And there are some people that have done that. I've had colleagues of mine that, you know, I'm going to be an obstetrician gynecologist, and they start residency and realize it's not really for them.
Right.
And they end up leaving a residency. It's difficult to do. You have to start over your residency. But if you're not happy in that field, you want to be happy in the field that you choose, whether it's going to be pediatrics, internal medicine, obstetrics and gynecology, going in and knowing what that field is going to entail for your entire life. And not that it can't be changed, but you want to invest your time wisely. So you want to research and find out what you really enjoy. That's when I went through my rotations and realized, yes, I do like surgery. I enjoy being in the OR. I just didn't like some of the atmosphere. It was not conducive to what my personality was, and I realized pediatrics, I had the most fun. I enjoyed my patients. I enjoyed the families. I enjoyed the work. I enjoyed the complexity of pediatrics. I enjoyed working with different age groups. And that's what helped me make that decision. Where others were like, pediatrics is not for me. I don't want to, my patients can't talk to me. I don't want to have to deal with teenagers, whatever it may be. So you don't want to choose a specialty that's not going to make you happy. Not that it can't be changed, but it is difficult.
Right.
It prolongs the process.
To an already long process.
Exactly, a long process already. But that's one thing, as physicians, we're good at delayed gratification. Think about it. We go through school, we go through college.
Yeah.
And a lot of our friends have graduated college and started their careers, started their families, and then we're still going through school. And you're going through school, but the end point is going to be worth it.
Right.
So we're very good at that delayed. Okay, we just keep pushing forward. At that point you are going to reach that. So you finish up medical school. Now I have residency. You take it each step, but you know that the outcome is going to be worth it. And we're much better at doing that. Physicians in general are pretty good about delayed gratification. A lot of your friends are they're living their life. They're having their families. They have the job, they're making the money.
Yeah.
And we're still in school. But it's all worth it in the end if you're putting in the effort.
As a woman, I would personally like to know your take or your experience as a woman in medicine.
Well, in pediatrics, it tends to be predominantly female. The trend is shifting. There's a good 50 to 60% women now in the field. And each field is different. Surgery, orthopedics, plastic surgery, that women are making more strides. Medical school classes tend to be predominantly 50-50, or maybe even a little bit, some schools maybe a little bit more predominantly female nowadays. And even in the 20 years since I graduated from medical school, I could feel a difference, not just being as a woman, but as a minority medical student. It was not as prevalent.
Right.
And I trained in an area in the Midwest, so both my minority status had me stand out a little bit more. But it's changing, and we're starting to see more women in areas that were predominantly male dominated. Your surgical fields, administrative fields, education, the faculty. We're starting to see more women in those fields. We're seeing more women coming into those leadership roles. So I've seen the changes where before it may have been, a few female colleagues that you would see in the doctor's lounge. You're seeing those numbers increase. So you know that they're making headway, and that is impacting family life, because women are making those changes, because women have families and they are somehow balancing being physician and being parents. And it's working. We're in the right path. We're going in that direction. So we probably should see less and less of that stigma of women who are taking time off to raise their children, or their dedication to medicine. Because at one time, if you're a doctor, you're a doctor. You don't take time off to take care of your kids. Or, if you're a woman, then you obviously shouldn't be a doctor because you have family responsibilities. That's shifted. There's no longer that stigma is drifting away.
My last question for you is, would you choose peds again?
Yes, I would. No doubt. Like I said, this was a big surprise to me when I was in medical school, because I didn't even consider it. But I get to choose my time, how long I want to spend with my families. I'm not having to spend my time all in the hospital, even though I do enjoy hospital work. But overall, in my 20 years, I've actually now started to see some of my own patients now bring their children to me. So I'm getting to see that whole life process, which is very gratifying. I enjoy watching the kids grow up, progress in school and making those strides, and now going off to college. That to me is very gratifying. Watching these kids grow up. My goal is to help families raise their kids, make sure they stay healthy, make sure nothing bad happens to them, so they can be the productive adults. So I would definitely choose this again. I think I made the right choice.
Yeah.
Yes.
Good. So do you have a plug or anything else you want to share, or anything that you think that all students interested in pediatrics should just know?
Well, for students, even if you have a set idea of what you want to practice, you said, I want to be in internal medicine. And that particularly third year, if you're starting your third year, keep an open mind. Go into each rotation with the goal of, I'm going to do the best I can, I'm going to learn the most I can. I may never see obstetrics or gynecology again, but get the most out of it. But gain as much knowledge as you can. You never know, you may end up liking that field that you never even considered. And obstetrics and gynecology was the one that I really didn't like, but I realized I liked the babies. When I realized that, what did I like about obstetrics and gynecology was the baby. That's what I liked. But going in, and particularly in third year, keep an open mind. You may surprise yourself. You may end up liking that surgical rotation more than you thought. Keeping that open mind is really going to give you a better experience. If you go in with, I don't like psychiatry, it's going to be the longest rotation that you'll have to experience. Go in with it. Let me learn as much as I can about psychiatry. I may not ever take care of patients like this before, but you know what? Some of that knowledge will transfer. If you go into internal medicine, you may deal with patients that are going to have psychiatric illness, and you'll be able to provide them help. I still use some of my psych history, even though I do work with children, but there's information that I gleaned for that. Go in with it with an open mind and make the most of your experience. Don't rule anything out, because medical school is hard enough as it is. And if you have a negative kind of attitude towards a rotation, it's just going to make things much more difficult. I hate surgery. Yeah, you're going to hate it even more at the end. So as a student, keep pushing forward. Keep your eyes open and keep your mind open to the things that you can learn from each rotation. And that's going to make your fourth year even better, because now you get to pick and choose a little bit your electives. You're going to gain more out of them. You can make wise choices in terms of your elective. If you like pediatrics, consider doing some pediatric electives. So consider doing that stint in the ER, because you're going to get to see kids. And use that interest, but keep an open mind and try different things in fourth year to enrich your experience. Because once you go into your residency, you're just going to stay in that field, but gain as much information as you can. It just makes life much more pleasant. It's hard enough as it is. Don't make it any more difficult than you need to on yourself.
All right. Well, thank you for sitting down with me, answering all of our questions.
You're welcome.
If you guys have any more questions that you want me to get answered, please leave them down in the comments below. Thanks for tuning in, Gems, and I'll see you guys in my next video.
Bye-bye.